Hello everyone. So in this video we are going to talk about anemia of chronic disease, which occurs because of a chronic infection, inflammation, and is common in developing countries. The causes include chronic infection, immune disorder, malignant tumor. Chronic infection that are common in India are tuberculosis, osteomyelitis, and infective endocarditis. The immune disorder or autoimmune disorders are the inflammatory bowel disease, Crohn's disease, systemic lupus erythematosus, and rheumatic arthritis. The malignant tumor, carcinoma lung and carcinoma breast. The point to be noted is that anemia of chronic disease is not applied to anemia that is associated with renal, hepatic, or endocrine disorders. Now, anemia of chronic disease, you will find it very common among the patients with TB, Crohn's disease, or having some malignancy. The pathogenesis is quite simple. In cases of chronic inflammation, there is increased release of interleukin 6 and TNF alpha, which induce the release of hepcidin from liver. Now, this hepcidin is a molecule that is going to inhibit ferroportin, that is a channel for absorption of iron from gut lumen to the gut cells, GI epithelium. Now, in cases hepcidin inhibits this ferroportin, there is decreased iron transfer from this site to the erythroid precursor. So, there is decreased availability to the progenitor cells and there is decreased synthesis of RBCs. Also, there is decreased erythropoietin production that is amplifying the anemia. Now, what we see in the peripheral smear is the normocytic normochromic RBCs. There is similarity with iron deficiency anemia when we go on to the investigations of anemia of chronic disease, but there is a contrasting character that in iron deficiency anemia, because of decrease in serum iron, there is increase in total iron binding capacity, whereas in case of anemia of chronic disease, though there is decrease in serum iron, there is decrease in total iron binding capacity. Other features are similar to iron deficiency anemia, but also there is normal transferrin receptor, whereas iron deficiency anemia, the transferrin receptor level increases. The serum ferritin is increased because it is an inflammatory marker. We manage the condition by giving treatment of the underlying disease. In cases there is no improvement, we can also try recombinant erythropoietin therapy. So this is brief about anemia of chronic disease. Thanks for watching.